The topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Good afternoon, Houston. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. I have been doing this show now for 12 years, and we've probably done 3,000 or 4,000 shows. It is amazing when you have a show like we have on this first show that you've kind of named the show after our first guest today because it's Ask the Experts, and he is such an expert. It is probably one of my favorite shows to do. It's the easiest show to do, and we always look forward to it each month. Let me introduce you, our expert, Dr. John Van Slate of Augusta Drive Dental Care. How about that for an opening?
Wow, Steve, thank you so much. I don't know if I'm worthy of that, but I appreciate you.
No, you are.
Yes, thank you.
You know what? I've told you before during the show, I love the way you explain to people. Yeah, I mean, you should have been a professor. You are wonderful because the mouth, the gums, the teeth, the implants is so intricate, and you just have a way of making everything so interesting. I don't know, you don't know this. We missed our show last month. We've gone to TikTok, which is thousands and thousands and thousands of new viewers and listeners. So we have all these new people. Tell people about your practice.
Well, I'm a general dentist. I practice in the Galleria of Houston, and I basically do all general dentistry. But I love doing, really complex cosmetic cases, lots of TMJ, lots of sleep issues that we treat here in our practice, and restoring a ton of implants. So that's what we do, and just love doing this.
And you also help people to stop snoring.
Oh, absolutely. Yeah. I know we've done a few shows on that, and I'll do another one soon. But yeah, we have a lot of success.
Exactly. So tell me about, is there new things in the industry that are happening or about to happen?
Yeah, well, Steve, I can tell you anything about dentistry. It constantly changes, and there's constantly new things going on, right? You have to do everything you can just to keep up with it. But just to give you an example, right now, artificial intelligence is absolutely hit dentistry in a big way because Vidya, the really innovative IA company, they have come out with a program where they can take our digital x-rays and they can now detect cavities, bone loss.
Bone loss?
Yes, it can detect everything. I mean, we can see it on an x-ray. But what it does is those gray areas where, you know what, it's like having another dentist in the room for me, because now it can confirm what I'm seeing in a very objective manner. I don't have to guess. So those things where I'm thinking, is that a small cavity? Well, this confirms it for me. And so I'm able to be a better dentist, and I can do things in a much more conservative manner by catching things early. So it's really an amazing technology. We've had it probably now, I want to say since January, that we've been using the AI. And
one company really, doing this?
What's
John?
that? What's
Is
that?
it just one company who's manufacturing this?
Well, I'm sure there's going to be a lot in the market soon, but the Vidya AI is the one that I'm using right now, and they're the ones that have really pushed it in the dental market currently. It's new technology, but it's going to really revolutionize what we're doing.
So the bone density is going to really help with dental implants.
It could help. Well, we're using it more on teeth right now, not so much in the bone. It can see bone loss, but I think that what you just said, that technology is coming. I can almost guarantee it.
Wow. There's people have so many questions about dental implants.
Sure.
It is, I had it done myself.
Sure.
Changed my life, John. And you see people all the time that come in and that smile looks strange because they don't want people to see the missing teeth. And when they go through the whole process with you, they're like a different person.
Yeah, there's no question. Dental implants, nothing can change or restore the form and function and aesthetics. It looks just like a natural tooth again. Nothing is better than a dental implant. It has really, really changed dentistry. And believe it or not, I didn't even think about talking about the new stuff in dentistry with implants because we've been doing it for 30 years now. And it's got such a long track record of being very successful. But it does change lives very quickly. It's given us things. We can do things with dental implants we never even dreamed about before. So it's a revolutionary thing, no doubt.
Do you think, John, that dental implants will ever totally replace dentures?
Well, I think for the most part, it can totally replace dentures now. It is just a choice, Steve. I mean, some people choose to have implants and have a denture. Some people choose to have implants and have all the remaining teeth changed. It runs the whole gamut. And we're there now. I mean, you can choose not to have a denture at all, or you can have a snap-on denture. But what you can do with a dental implant in those scenarios is really limitless. But we're there. You don't have to have a denture anymore. It's crazy.
I was surprised there is no pain involved in the dental implants. I didn't feel any pain whatsoever. So I'm telling you, if someone is thinking about it, they can come in and discuss it with you, can't they?
Absolutely. No, all day long. Absolutely. I encourage you.
I know, Dr. Van Slake, that it's so important that people get their dental problems diagnosed early. And I know how important that is. Tell people some of the things. I mean, I don't care. It might scare some people, them into getting these problems taken care of.
Yeah. I mean, for me as a dentist, what always makes me sad for people, somebody might not have been to the dentist in 6, 7, 8 years. And all of a sudden they come in and they have a mouthful of problems. There's no doubt that if you get checked regularly and we can fix things before they become bad. I mean, you can virtually, with regular dental checkups, you can almost eliminate root canals, periodontal disease, extractions, because you're catching those kind of problems before they happen. But as a dentist, we're trained to fix problems. We're trained to go in there and if it needs a filling, we put a filling in. If it needs a root canal, we do a root canal. But I'm really proud of my profession right now because we are now really, really starting to become really preventative minded. And I'll give you an example. There's a product out right now called Curodont. That's Curodont. You can Google that, but it's called Curodont. This material actually heals enamel. It'll actually cure cavities. I've always had people come in and say, "Hey, Dr. Vance, I wish you'd have something you put on my teeth and the cavity would go away." We have it now. It's blowing my mind, But let me tell you about it because this technology has been around, European countries and Asian countries for quite a while. But after going through a lot of research and testing, we finally got FDA approval at the beginning of the year. So we've been using it here in my practice for about 5 months. It is a very simple process, but what it is, it's a gel. You just place it on the tooth. It takes about 5 minutes, no anesthesia, incredibly easy to put on. But you place it, and then this gel has an affinity for weak enamel, and it acts like a scaffolding that just gets on the tooth. And then in our saliva, which are natural phosphates or calcium in our saliva, it binds to that and literally heals and remineralizes the broken down enamel. The key is it's got to be early cavities. It doesn't work if the cavity's already soft and deep, But for those new cavities, it works phenomenally well, and it's easy to put on. And that's where AI is so good for me, because now, especially between the teeth, where I might not have recognized it before, now if I see that on AI that there's a little small lesion, I can put Curadon, and I don't have to go in there and drill the tooth. It's amazing technology. It's new,
Wow.
but we'll see. And it's only supposed to be like a one-time application. You put it on one time and it heals, and we just look at the x-rays the next time and see how you're doing.
How do people, is there a way to prevent gum disease?
Well, I will tell you this. Absolutely. I think that as far as gums are concerned, excellent home care is a must. You have to take care of them at home. And the best way to prevent serious gum problems is just get regular cleanings with a dental hygienist. Somebody that's professional that can find problems before they happen. That is absolutely the best. But we have a product out here right now called Perio Protect, Steve, that's kind of like, the Curadont for the teeth. Perio Protect is a gel that a person can use at home on a daily basis that can go and kill the bacteria below the gums. We've never had anything like this before. We've been using it for about 2 years in our practice. But let me just show you this. It's this little tray is the key. This is called a Perio Protect tray. The key with this tray is the edge of it has what it is. It seals and has a siphon effect. It actually pushes this gel below the gums to kill the harmful bacteria. And what I love about this, it's better than brushing and flossing to get down in those pockets or it reaches areas where the brushing and flossing wouldn't work. But this little guy, now I have something that people can do at home 15 minutes a day. You just got to find those 15 minutes. But if you can wear this tray, you will absolutely have much healthier gums. We recommend it to anybody with bleeding gums. I recommend it to all of my periodontal patients. And the fact is, 95% of people over 50 have got periodontal disease somewhere in their mouth. So this little tray really helps everybody.
That's high.
It's the real deal. And healthiest people in my practice are using these trays. It's amazing.
Dr. Van Slyght, this is amazing. I haven't talked to you in a month, and I'm hearing all these new things now.
Yeah, things are changing at the speed. Yeah.
Is it hard to keep up with all the changes as fast as they're happening?
Steve, you got to be a perpetual student. And that's what I've learned in dentistry. I've never been one that likes to just sit around and just keep going things status quo. I love learning, but I will tell you that you have to take a lot of education in my field to stay on top of things. And I do love that, but it is a big commitment. There's no question.
So now you're going to tell me there's something out so you don't have these messy impressions anymore.
Yes. Well,
is it really?
Yeah. Well, you just had dental implants. I don't know if you had impressions for that or not, but yes, there's a machine that we're using called digital scanners. They're the one I use is called an iTero, but it's a very interesting thing. It's like I got one right here. It's like a video camera that you put in the mouth. And it basically goes around the teeth and it makes an image of the teeth. I can then take that image and email it to my lab, like in a file, and they have a computer that can mill it in their lab. And the beauty of that, Steve, it does take the place of impressions. And that if you think about an impression, you always have a little distortion in an impression, or a void could happen. With digital scanners, you get a perfect impression every time, which means my restorations are so much more definitive. They're so much more precise. I put things in that the margins are much better, and I don't have problems with having to take long putting things in anymore. But I use it for crowns. I use it for bridges. I use it for partials, bite guards, sleep appliances. I use these scanners for everything. No impressions. It's really awesome.
Does that replace? I remember my dentist would put like a piece of paper, colored paper, and I'd bite down on it to get the impression. Is this replacing that?
Well, that's a little bit different, Steve. That's when we're trying to correct. We're checking the bite position, making sure that our restorations are hitting comfortably. Then we use that. It's called articulating paper. Yeah, but that's not an impression. That's just checking, just to make sure that the bite is hitting
The
properly
bite.
when you're chewing. Yeah.
So from the last time you're on, we got at least 4 letters. One lady was telling us how much she loves your show. But for parents who have young kids, what can they do now to prevent teeth problems in the future when they become adults?
Well, I will tell you this. You know as well as I do, dentistry's come a long way, right? I still feel like children should be having regular checkups just like adults should. And the earlier you start, the better it is. I think there's a couple of times where a child should really be seen. 3 years old is a critical time. We're going to check for arch development. We're going to check for tooth development. We're going to look for obvious problems in the developmental stage. The next time, orthodontically speaking, is going to be another thing with kids. While they're going through their early years and formative years, we're checking for tongue position. We're checking for breathing disorders. These things can affect how the teeth are coming in. We check for tonsils and adenoid problems. So those are incredible things that we can do on children that must be looked at. And then, of course, that 10 to 12-year-old range where we think about orthodontics. Do we need to expand the arch to make sure there's room for the teeth to come in? So the key is you have to take incredible good care of your teeth, but you need to have regular checkups, starting at as early as 2 years old, really, to make sure that everything is looking good.
It's one of the letters said, "What kind of toothpaste do you suggest?"
Well, you know what? I tell you what, there's so many great toothpastes out there. Really, the good answer is anything that's FDA approved. There's so many good ones. You can't go wrong with most of them. It depends if if you're more of a holistic person, you can go with the Toms of Mainline, or there's so many of those on the market. And then, of course, the Crest, the Colgates, and things like that. You can't go wrong with that. I love the Sensodyne lines. I'm recommending those probably more to my patients than anybody else. The Sensodynes, the Parodontax, all of those are great toothpaste. But the important thing is just be brushing.
We got a text in from Galveston. Love your show. What are your hours?
Well, right now we are in the office Monday through Thursday from 7:30 to 4:30. Those are my office hours right now. And it's by appointment. Just call up and we'll try to accommodate anybody as best we can.
What about tell everybody what you're doing in laser?
Sure. And I know we've talked about this before on some of our other shows, but we use lasers all day, every day in my practice. Matter of fact, everybody who gets a cleaning in our practice, our hygienist uses a laser on. And we call that laser bacterial reduction. But what a laser does during the cleaning is that you can take a laser, place it below the gum tissue, and it's like a flashlight. And the wavelength of that laser light kills the harmful bacteria that causes periodontal problems or tooth decay. So, when we use our conventional cleaning tools and scalers, it's great to clean out all this bacteria, but the laser actually kills the bacteria. So hand in hand, we're finding that it is a great combination to make sure our patients are as healthy as possible. But we also use lasers for periodontal treatment. We can do periodontal surgery without sutures, without bleeding. I use it all the time to release tongue ties under the tongue. I treat ulcers with it. I can put my laser on an ulcer, Steve, and those painful ulcers will go away by the time I finish with my treatment. And it'll also make the ulcer go away in half the time with our laser technology. So I use it for that a lot. It is just limitless the things we're doing with lasers now.
You are also, do you do the invisible braces?
Yes. Now, they've been out for a while now.
That's wild.
People are bombarded on TV all the time with invisible braces. So, basically, we do Invisalign in our practice, and here's a little. That's an Invisalign clear aligner. But what they are is they're plastic aligners that fit. They snap onto the teeth just like just like so. They just snap right on. And you can see when they're on, they're basically invisible. You can't tell that they're on the teeth.
Wow.
And the beauty of this is that when somebody comes in, I use my digital scanner that I was showing you earlier. We scan the teeth. I can take that scanned image, send it to the Invisalign software people, and they can tell me exactly how many aligners it's going to take to do the treatment, how long it'll take. It'll tell me, and it also simulate the way a person will look, so I can show a patient exactly how they're looking with the final product before they even have to commit to it. But the phenomenal part about Invisalign is that, man, for older folks who don't want to wear metal braces, it is a game changer. I guarantee you, everybody out there has got friends and these that are Invisalign. They don't know it because they're invisible, but they move teeth. There's some things you can't do with it. And as a dentist, that's what we are trained to know. What can I do with these that are what might be better handled with the metal braces? And so that's what I do. I like to do things that I can get in, I can get out in a reasonable amount of time. The average person is in this really under a year, usually in the 10th month range, 20 to 25 aligners, and each aligner has a correction in it. But I can get in and out in under a year, and this is unheard of. And I can do that because this technology only moves the teeth that need to be moved the exact amount that they need to be moved. And that right there means that we can do things a lot quicker.
You are so state of the art. I mean, can you imagine how it was, say, 10, 15 years ago, and how are things now?
It is totally different. I don't think anything I learned in dental school, anything I was trained to do then, I don't do it that way now. It's completely changed.
But it's got to be so much fun for you, though.
Oh, it is. Yeah, very rewarding. I mean, anything that I'm doing especially in the cosmetic realm, when you're changing the way a person smiles and when they look at the world, it is
Absolutely.
Truly a life changer. It's it is the funnest thing that I do, and I enjoy it so much.
We got a text from can't read the name of where they're from. Anyway, it's a mother, and she wants to know, can Invisalign replace braces for a teenager?
Yes, all day long, every day. Yeah, I mean,
wow.
You can do Invisalign with
Meyerland.
Whatever you're doing braces on can be done with Invisalign. There are certain hard corrections, like bilateral cross bites, where you're having to really expand an arm. Those are better with metal braces, and those are the things that you just have to recognize. But for the most part, you can do anything with Invisalign. Yes.
Wow. Because those kids, I mean, there's always embarrassed kids making fun of them in school with the braces on, and to get something that could maybe replace that, that's just amazing. Sure. Dr. Van Slate, tell people how they can contact you to make an appointment, as well as your website.
Sure. Well, drvanslate.com is my website. And to make an appointment with our office, 281-886-3164. And I tell you this, certainly I'd love for everybody to come to me, but the important thing is, if you got a great dentist, just make sure you're going regularly. That's the most important thing I want to tell people. You don't want to go a long time without having a dentist look at you.
Dr. Van Slate, thank you so much. We're going to see you again next month on Ask the Experts.
Awesome.
Take care, Dr. Van Slate.
Maybe I'll talk about TMJ next time, Steve. How's that sound?
Okay, good. Good. All right. And you know what? Right, we had Thrust, too. Thrust.
We'll do it.
Okay, buddy.
Thanks, man. Have a great day, Steve.
You too, buddy.
Take care.
That's Dr. John Van Slate. He is amazing. Amazing. He's a dentist in the Houston area. He's been with us for several years. That's it for us today. We'll be back again with you next week with more Ask the Experts.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.